Hello, my name is Abby Roberts, Senior Director of Product Marketing for Datasite. Thank you in advance for attending our Restructuring Leadership Series, Navigating the Storm, featuring Taylor Phelps at Cantor Fitzgerald. The global crisis has had a devastating impact on industries and regions worldwide. No two industries or regions are alike, however, and they are all experiencing the impact of the crisis in different ways. That's why we're conducting a series of short interviews with industry experts to provide guidance on the financial challenges ahead. All right. And with that, I'd like to quickly introduce Taylor Phelps, Managing Director at Cantor Fitzgerald, to talk about healthcare services. Taylor, obviously, healthcare services is kind of at ground zero when it comes to the current global crisis. We owe so much to the medical professionals and staff who are putting their lives on the line every day. But from a business or financial perspective, what has the impact been to recent market events?
Yeah, I think that within global healthcare services, it's been incredibly mixed. I think that you've definitely seen some providers that have seen a fair amount of pressure. Other providers have volume surges, but it's not necessarily really profitable volume. I mean, I think a lot of the core service providers are pulling their weight and doing some really heroic things right now. Are any in as good a position as they were, 3 weeks ago? I'd say other than maybe telemedicine, the answer to that is probably no. I think almost everybody is at least somewhat down, and nobody's excited about this. Within the sectors, the ones that have seen probably the most pressure are the specialty multi-site groups. If you think about dental offices, dermatology groups, ophthalmology, all of those businesses are incredibly soft. Less volumes, less people going to the office, a lot of reduced operating hours, things like that. In the facility-based healthcare, most non-urgent, non-acute episodes are soft as well. People are avoiding healthcare facilities at all costs because they don't want to get infected, which I think makes sense. Urgent care, very similar trend. Volume deterioration, all of it driven by patients just avoiding the urgent care clinics because they're worried it's not a safe place. Acute care is, depending on what market you're in, I mean, there are obviously some acute care hospitals that have a tremendous amount of surge of volume from COVID-related diagnosis. Most of those cases, though, are not incredibly profitable to the hospital. So hospitals traditionally have made a lot of their money on the surgical electives in the OR, and that piece of their business is mostly shut down. If I want to talk about a few of the sectors that have done that have kind of outperformed, closed door pharmacy, mail order delivery. A lot of people ordering stuff online now, so that tends to be a sector that has been a little bit more resilient. Home infusion as well. Patients moving out of infusion suites in the hospital and having that done at home makes a lot of sense, especially in the current environment. As well as telemedicine, I mentioned earlier. Telemedicine is by far the highest performing area of healthcare services by orders of magnitude. So that's kind of the state of play. I mean, I think that the areas that we're watching really closely are, as I said at the beginning, the multi-site specialty physician roll-ups that have seen some very significant deterioration. It is a very significant portion of the kind of the investor pool within the market that I live in, which is middle market M&A. So, I mean, this is 50-60% of the deals that have been done over the last 5 or 6 years have been these multi-site specialty roll-ups, and all of which are right now, I think, pretty nervous in running scenarios on what all that means.
Yeah. So what are you advising them right now, or sort of what are they kind of looking at in those scenarios?
Um, well, I mean, my clients are running kind of three different scenarios: 3 months, 6 months, and 18 months to try and figure out how long this is going to last. What's the,
Right.
what does the new world order look like kind of post recovery? And nobody really has those answers yet. So it's very early. I think right now, you're not seeing a lot
Mhm.
of, you're not seeing a lot of rescue financing, emergency situations that are actually actionable, but it is early. It is really early. You are seeing on the lender side, there's a lot of chatter. Revolver draws
Mhm.
have been pretty much maxed out, especially within the multi-site groups we just talked about. So lenders are seeing a heavy increase on companies pulling revolver just to make sure they're managing their liquidity over the short term. That can only go on for so long,
Right.
right? If you max out your revolver, eventually you run out of capital. If you stay shut down, what's next? I don't know. I mean, here in kind of, later in April, early May, we'll get a feel for kind of how companies are performing in their covenants, which they're obviously are going to be terrible, but how the lender community reacts to that will go a long way to understanding what the restructuring activity is going to be. Most of these businesses that we're talking about that are pressured are really good fundamental businesses. So,
Mhm.
it's it is going to be an area where I think that the owners of the company today are going to be highly reluctant to. They're going to do everything they can to not take some sort of financing product that's going to be super expensive and potentially crippling. I mean, these are good fundamental businesses, and they're in a different place than they were 3 weeks ago. But I think the expectation is that they'll go back to being good fundamental businesses when the smoke clears.
So do you expect to see maybe more consolidation, or what other kind of restructuring type tactics do you think your clients are kind of thinking through right now?
Look, liquidity is going to be a big issue. I think that there's a lot of activity in the lender base and trying to figure out if there are opportunities to backstop some of the lenders that may get themselves into situations that are too difficult to manage. So expect kind of capital to flow that way,
Mhm.
to play um, in the restructuring activity. I think that from a standpoint of increased or you know um, the consolidation market within healthcare services in general and how that plays out post COVID,
Mhm.
that's going to be really interesting. I mean, on the one hand, you would expect economies of scale and the ability to manage crisis like this to continue to favor the trends that we've seen over the last 10 to 15 years, which has been consolidating fragmented markets. On the other hand,
Mhm.
particularly with the physician groups, you doctors are going to need to, if some of those things do go sideways in significant ways, a lot of those businesses are built on inorganic growth thesis that effectively is encouraging doctors to join larger practices, independent physicians, community physicians in local markets or nationally. And I think if a lot of those go sideways, I don't think that's going to happen. But if it did, it'll make that
Mhm.
sell tougher for the future. And I think that physicians may elect to be independent more often than not, rather than joining a larger practice that's investor owned or investor managed. So that's going to be a trend to play out. And most of the ancillary services, no, I mean, I think you can expect that events like this will increase consolidation, both in the short term and long term. And that was certainly the case, in 2008. Very different situation, but certainly the case.
Right. Yeah, it seems like this time things are moving much faster in a way. So I'm kind of curious.
I mean, I think that, this, I've never seen, of course, I don't think any of us have, but the 2008 situation was, in some cases, rapid as well, but it played out over a course of a level of months. And then I think that when the credit markets slowed down, they did rebound really quickly. But it was fundamentally, it was a banking crisis. So the fix to the system involved, really just kind of getting the banks back in business and managing their liquidity. Here, with kind of everything shut down, it becomes a much more difficult process. And I hope I'm wrong, but I think you can expect the recovery to last a bit longer.
Wow. That's, I hope you're wrong too, but this definitely seems a lot deeper and worse than last time. Though last time I kind of remember as well, just a number of processes being put completely on pause. Are you seeing that as well, Taylor?
Yeah, no, we clearly there's definitely some things that are pushing forward. The M&A market in general, though, it's a lot of, in the world that we live in, a lot of the auction processes have been put on pause, and waiting to see kind of how this will rebound from there before hitting the go button again. I think that that's very sector specific. Some sectors are anything that is kind of quote unquote shut down clearly isn't going to be going through a process right now. Businesses that are still performing fundamentally but have risk with the credit markets and things like that. They're continuing to push forward, but a deal likely will not price and finance until the smoke clears at least a little bit. So it's mixed. I think that we've in a few of our situations been using this time to we're moving a little bit slower, but we're educating buyers and getting people up to speed on certain processes with the expectation that there will be eventually a clearing of the market here. But I think that in terms of actually getting something done, that's going to be dependent on whether or not credit markets and equity markets are open. And right now, they're for the most part closed.
Yeah. No, that makes sense. Though I am curious, you touched on telemedicine as kind of one of the brighter spots. And I wonder if there's a pickup in interest in those sectors, kind of more of a let's wait and see how this plays out so we can get more of a stable kind of financial estimate.
Yeah. It's a good question. Clearly, from a fundamental basis, the telemedicine providers have seen incredible volume growth over the last 3 weeks, right? And that makes all the sense in the world. I don't think anybody's really surprised by that. But I mean, from a actionable process situation, taking an investment, monetizing those earnings, it does present certain challenges because we don't know how long this is going to last. Right. As things go back to normal, those earnings will to some extent dissipate, right? They'll mature to a normal, and we don't really know what that looks like. I do think that overall, you can expect a situation like this is going to drive utilization of telemedicine that will persist into the future. I think you can expect that. I don't think it's going to be a kind of a one-time event, but how that's modeled and how that plays out is very much kind of TBD right now. I mean, I think that, it's just early to tell kind of what this is going to mean long term, and how much of what you're seeing right now is one time, or is fundamental changes to the industry. That's a really good example where it's going to be tough to value a company off of something like this that very well could be short term in nature.
Yeah. Are there any other kind of strategic questions that you're talking to your clients about, or you think companies in this industry should be thinking through right now? Or is it sort of, as you talked about, kind of a wait and see?
Yeah, I think that clearly my clients are focused on both making sure that they stay open and take care of patients and take care of customers. And that involves, keeping a clean work environment. They're worried that if somebody in their immediate office space gets sick, that it could impact their ability to kind of manage staff and actually, deliver on behalf of their clients. So that's probably the most significant concern, at least in the short term, as it relates to the supply chain. So, things could change in that regard. From an operating standpoint, if you're shut down, you're shut down. There's not much you can do about that other than manage operating costs as best you can. Some of those costs scale down, others do not. And that's obviously quite a difficult situation. For the businesses that are performing along, they're working on making sure that they're managing their staff, making sure that they have the appropriate resources in order to deliver. Because anything that is mail delivery or home delivery kind of products and services right now is seeing some pretty significant tailwinds and some demand increases, and those businesses are working hard to make sure they fill that need and they stay open and stay healthy.
Yeah, that makes sense. And so, final question: what are some kind of practical next steps? And you mentioned like buyer education. I know on our side, for example, we're seeing kind of a run on what I think of as in case of emergency, data rooms or repositories. But what are other kind of practical next steps that you would advise people to start thinking about right now?
I think if you're considering a liquidity process, if you're considering some sort of, if you were, a month ago, I think you get ready and get prepared, right? And I think if you can do that with minimal involvement or focus from the management team, I think that makes all the sense in the world to just kind of use this time to get your materials in order and be ready to approach the market. We don't know kind of, how this is all going to play out and how fast the recovery will be. But I think you can reasonably assume there'll be some pent-up demand and a lot of interest in the market and really good businesses. So that's all I can really suggest kind of doing in the near term as it relates to my world. In terms of situations that could get sideways and whether or not those are actionable, as I said earlier, I think that's one that is going to be very company specific and sector specific. And ultimately at the beginning, it'll be driven by the lenders. So if lenders get in situations that they need to sell down, maybe there are opportunities to make some calls and be a solution for the lenders. In terms of the equity holders, you're probably looking at more of the middle market, smaller middle market funds that haven't raised as much capital. May find themselves in a situation where they need some help terms of the larger funds, you know, my guess is for the most part, they're going to do what they can to kind of backstop the businesses that they own for obvious reasons, and so probably less of an opportunity there. Yeah, I mean that's kind of what I'd be thinking about and preparing for.
Okay, great. Well, Taylor, thanks again. I know you're super busy, so thanks again for jumping on this video with us. And with that, I'm going to end our webinar for today.
Thank you so much. Appreciate it.
Thanks, Taylor.